If you're suffering with sciatic nerve pain, you know that there's a lot of advice out there about what you should and shouldn't be doing. And chances are, if you've been watching videos for a little while on YouTube, that you're a little bit confused about what it is that's okay to do and when it's okay to do it, because there's different timelines for everything. And of course, we've got to remember that every body is different. So just because you watch a video that says, oh, this exercise is the best one to do, it could actually cause you some pain. So today we're going to be discussing the top 5 things that you should be doing if you have sciatica pain. Before we get into that, let's be clear about what we're talking about. Sciatic pain is pain that is going potentially from your low back, definitely down the back of your leg to your knee, and maybe traveling down the outside of your calf. That's the pain pattern because that's where the sciatic nerve runs. It is made up of the L4 to S2 nerve roots, which come together to form the sciatic nerve. So if you have pain that is down the outside of your thigh or the front of your thigh, then what you're suffering from is not sciatica. And any of these tips or anything you watch about sciatica may not be helpful for you. So if your pain is down the back of your leg, potentially to your knee, and maybe down the outside of your calf, then you are in the right place. Okay, my number 1 tip when people have just started to have sciatica is rest and ice. Now, I usually don't agree with rest, okay? But in the first 24 to 72 hours, in general, for some people, it's up to a week, their sciatica is so flared up that they cannot move normally. And although movement is life and every tissue in your body is designed to heal itself as long as it's moving correctly, if you're not moving correctly, then you're going to be causing damage. So I want you to be resting initially until you're able to move safely. You do want to make sure you're icing so that you're decreasing the inflammation as much as possible. Which leads to tip number 2, in that I want you to do as much pain-free motion as possible. So a lot of people get really confused because these two seem a little contradictory. When do I rest and when do I do pain-free motion? Well, you do pain-free motion as soon as you can. So let me give you a story here. I had a patient years ago who had my personal cell phone number. She calls me on Saturday morning. She was trying to plug in her vacuum cleaner, all of a sudden got hit with sciatica, ended up on the floor crying, and didn't know what to do. So her husband comes in, finds her there, and says, what do I do? What do I help? Do we need to go to the emergency room? Do I call 911? I don't know what to do. And she's like, give me my cell phone. I'm calling Dr. Amy. So she calls me on Saturday morning. I hop on the phone with her. I listen to her story about what's been going on. And I'm like, okay, here's what I need you to do. I need your husband. You stay on the floor. For right now, you stay on the floor, girl. Stay on the floor. Have your husband bring you an ice pack. So she got into a better position and was able to get some ice on it initially. And then once things had calmed down, we did some breathing to make sure that she was breathing correctly, get that vagus nerve stimulation. Then we were able to give her a little exercise to do that after 20 minutes on the phone, she was able to get up off the floor. Now, I'm not saying she was pain-free. It's not a miracle cure, but she was able to get off the floor. She was able to sit in a better position. So she did some sitting for a while, she did some lying down for a while, she did some gentle walking for a while, and we created a program that would get her through the weekend. That night, she actually hosted a dinner party. So, she was actually doing pretty well. Now, mind you, when she came into the clinic the next week, of course, we needed to address the issue, figure out the root cause, and get to the root of that. However, there are sometimes things you can do even within those first 24 to 72 hours, but they should always be things that make you feel better. If they make you feel worse, then you shouldn't be doing them. Okay, friends, it's time to talk about the most important myth that is on YouTube regarding the sciatic nerve. Many healthcare professionals will recommend that you stretch the sciatic nerve, either hamstring stretching or figure 4 stretching. Friends, I am here to tell you that the sciatic nerve does not like to be stretched. It gets really irritated. Now, I understand that it feels good initially. You're like, it feels so much better after I do it. But then when I go to bed at night, it's all flared up. Yeah, it's all flared up because you spent all day stretching it. I need you to stop stretching your sciatic nerve. And I understand your hamstrings probably feel tight and your hip feels tight. You feel like this is the right thing to do. I need you to stop doing it, especially while it's really actively flared up. Now, I will say for people with sciatic symptoms, obviously long-term, we need to make sure that their hip and hamstring stay super flexible. So once the situation has resolved and your pain has gone away, we may have you doing hamstring and hip stretching, but not while you're having active sciatic symptoms. Now, if you feel like, oh my gosh, I really need to stretch my hamstrings and I really need to stretch my hip, do it on the pain-free side. When you do this, it actually helps to draw pressure away from those nerve roots and can actually potentially be helpful. But if you're doing it on the painful side, I guarantee you you're just causing more pain and problems. And I know that so many people recommend this. I know that it is all over the internet. So I'm going to ask you to believe me and to not believe them. Try it for 3 days. Okay, just don't stretch that sciatic nerve for 3 days and see how you feel. Okay, if it doesn't make you feel any better, then okay, you can go back to stretching it. All right, is that a fair agreement? But right now, I need you to stop stretching it for a period of time to allow that sciatic nerve to actually heal. The next tip is to make sure that you are strengthening your abdominals. Now, do not hear that as I want you to go do a whole bunch of crunches and a bunch of craziness because, hello, that's going to irritate your sciatic nerve right now. But long term, you need to make sure that you're strengthening the abdominals. So when people are having a flare-up and their symptoms are really increased, like my patient who was on the floor, this was one of the things that I had her do. So when she was doing her deep breathing, I had her take that deep belly breath. And then as she was breathing out, which I have people do like they're blowing out a birthday candle, just like that, I had her contract her abdominals because her abdominals were not kicking in to support her body. This is actually what helped her get off the floor. So I'm not saying go do a bunch of crunches, but while you're doing that deep breathing, go ahead and do that abdominal contraction so that when you are able to get off the floor, those abs are kicked in. If you're not sure exactly how to do that, I'm going to link that video here so you can watch it, and it actually discusses how to do that abdominal contraction with that deep breathing. Now, when your sciatica symptoms are really, really flared up, my last tip is to make sure that you are using ice. Ice is a great pain inhibitor in that it decreases your pain. And yes, I understand that it doesn't last that long, which is why I want you to do it for 5 minutes every hour. When your symptoms are really, really flared up, it will give you enough relief for a short period of time that will allow things to heal and improve. However, you need to do it regularly throughout the day while your symptoms are really flared up. If you're past that 72 hours or week and your symptoms are kind of a little bit more manageable, maybe your limp's gone away, you're not as shifted as you were before, then you can just do it 3 to 5 times per day, and still you only need to do it for 5 minutes. But I need you to be icing regularly. That helps to decrease the inflammation, and it's going to make a huge difference in your pain, which is going to make a huge difference in your function, which is going to make a huge difference in your healing. All right. I have a bonus tip for you here if you are suffering with sciatica, and especially if this is not the first time, which I have a lot of patients who come in and they're like, yeah, I've been dealing with this on and off for the past 30 years, but it usually goes away on its own in a week or two. Well, friends, the truth of the matter is it doesn't actually go away. It's that your pain goes away. So what happens is that people come into my clinic. This is their 3rd, 4th, 5th episode. Maybe they've done PPT before. Maybe they haven't. It seemed to get better. I mean, the pain went away, but they never actually dealt with the root cause. The really sad thing is that some people have had surgery, and maybe not just 1, maybe 2 or 3, and the root cause has never been addressed. So they've had a microdiscectomy or 2, and sometimes 3, and they still keep having that sciatica pain coming back. And the truth of the matter is the surgery did not deal with the root problem. It did not deal with the biomechanics that were putting abnormal tension on that sciatic nerve that kept causing this problem. You see, the sciatica, it's a nerve, and it is just responding to the tension and pressure that your body is putting on it. is kind of like an alarm bell. All of our nerves are kind of like alarm bells. It's not so much that they get injured directly. I mean, yes, there are cases of trauma, but that's not what we're talking about today. What we're talking about is those repetitive stresses. We're talking about those abnormal postures. We're talking about that lack of movement that has led the sciatica to sound the alarm and get really, really painful all of a sudden. I guarantee you, if you're having sciatica and there's not a traumatic incident, chances are good that this has been building up for a while. So you really need to deal with the root cause in order to keep this sciatica pain from coming back. If you'd like to understand more about how sciatica pain or any nerve pain is related to the rest of your body and how everything's connected, I'm going to encourage you to look at my book, Movement is Life. In it, we discuss how all of these different things are connected, as well as some healthy strategies that you can do to improve your quality of life and decrease your pain in the long term.